Today I'm speaking with someone very close to my heart. Her name is Archer, but I call her Archie. So if you're okay with that, I'm going to refer to you as Archie. And I want you to start and talk about her diagnosis a little bit.
Well, she was diagnosed 3 times, one time incorrectly by a neurologist, the other 2 by a pediatrician with Tourette's, which she didn't have. She had sudden tics that came on, and I knew it wasn't in my heart, like many moms do, and so I pressed on, and we did get her the diagnosis of PANDAS, which is, a lot of people have heard of PANDAS, and PANDAS is a subset of PANS, and PANDAS is brought on by strep infection, and Archer's is brought on by any kind of virus, bacteria, or allergy. Anything can trigger it, so it's kind of scary, lots of things, and it causes a massive flare. So, yeah.
So Archie, your life was really normal. You're a great wrestler. You're such a beast. And this happened very suddenly. So tell me what that was like, what it felt like.
It felt like I was faking everything, honestly. Like, I felt like I could stop it anytime, but like didn't stop. And it just kind of felt like I was like put in a new body, like really suddenly. Cause if it happened slowly, I don't think I'd feel it as abruptly, but like, it felt like I was just like put in a different person's body. And it just didn't feel right at all. It just didn't feel like it was me.
So, Anna, I will never forget, you guys were in Tulsa, I think, at a museum, right? First time you noticed it, you said Archie's
Yeah, that's
doing
right,
this
Springfield
weird
in the
thing.
aquarium, yes.
And it was a physical tic at that point, and it progressed very quickly.
Yeah, within 5 weeks' time, she was having constant verbal tics and the physical tics. She started punching herself in the face, the throat, the leg, the stomach, throwing things. She spit once and said that's not going to be a thing, and she was right, it didn't happen again. But your life is completely out of control, and at night it looks very much like a possession where they would be speaking in tongues. It's exactly, wouldn't you agree?
Yeah.
Body writhing.
Worst at night.
Yeah, definitely worse at night. But a fast onset is not Tourette's. A fast onset is PANDAS or PANS, and it's accompanied by OCD, anxiety, and depression, hardcore depression and anxiety, and the OCD went through the roof.
Now, you have a great way of explaining this that I love, your cruise ship.
Yeah. So I'm the person who answers the phone all the time. Dr. K didn't say that. So the way I feel like being a parent or a caretaker of anybody with anything going on is it feels like you're behind the wheel of a massive cruise ship. It's like you snap out of it and all of a sudden you're behind the wheel of this cruise ship and you have no idea how you got behind this cruise ship, and you look around for someone to take the wheel, but there's nobody there, but you're like, but this is impossible because I can't drive this ship, but you have to drive the ship because no one else can drive the ship. And what I tell people is, especially with Archer, what I found is that Dr. K is an incredible captain, and you can let her take the reins, and then you can just sit in the back of the cabin and drink a margarita. You can stay and be present, but you don't have to worry as much.
Now, from my viewpoint, and I was going to say, not only do you work for me, Anna is our patient care coordinator, so when you guys call in to become patients or your prospective patients, Anna is the one that answers the phone, and she's your Lady Liberty. And you talk to people and help them through this very difficult time, often their moms or dads. And I'm the person that is supposed to fix all of it, and here you are, we're friends, close friends, and your daughter was in trouble and I wasn't helping her, and that was really a horrible feeling for me, because I wanted to help you. I mean, this affected school. It happened in the summer.
But I got to get out of school a month early.
That's right.
I had to pull her because I couldn't stop her from hurting herself at school, and faculty can't constrain her. So I just hit the point where I was driving and I said, I have to go get her, and I went and withdrew her from school. So, and then I remember the Friday before we tried something. Friday, I was getting catalogs in for back to school, and I ugly cried all day long. I just didn't know what to do. I was going to have to homeschool her. There was no choice. And then I came in, and on Tuesday, you thought of something, and you're like, I don't know why I didn't think of this before, and we tried it. And we went home, and it was like a switch just flipped, and it turned them off. Like 99% of the way. And we went to Natural Grocer, and the person working at Natural Grocer noticed right away. She noticed right away. Right after we did the treatment, we went straight there, and she noticed, a stranger. So that's pretty massive. That's how obvious her tics were.
So what I realized is that we're battling inflammation of the brain, essentially, and that's where we had to target it, and our therapy targeted that inflammation very directly, and I didn't know if it was going to work, and it did. And I know that now you're also doing some homeopathy and some other things, but how are you now?
I'm a lot better. It feels like I have more control of myself, and I don't feel like a different person. And I feel like a lot calmer. Like there's certain days where it's bad, but I'm not embarrassed to like go outside, and I'm confident like going to school and going back to wrestling.
You're not telling me to shut up all the time.
Archie, how old are you?
13.
Okay, so that's a horrible age for this. I mean, you're embarrassed by everything already, and this couldn't have been easy for you. And I want to add that for a little while, Archer wasn't really keen on doing this video, and you decided to do it. What was your reason?
I wanted to help more people after seeing or meeting other people that are going through things, whether it's like depression, anxiety, or PANDAS. And so I ended up helping my friend a lot through anxiety and depression, and after doing that, I felt like it was better to do this.
I'm really, really proud of you for doing this. And I know.
I know.
You've been to hell and back.
I have.
So I'm trying not to cry. I'm so proud of you, and I'm so proud of you, and I'm so, so happy that we figured this out.
Life was unlivable,
Yeah.
right? Completely unlivable. And I had actually told patients in here with their kids that had been so sick with CRPS, EDS, I said, it got to the point where I saw how she was living every day, and it was not livable, right? And I knew at that time, I said, if she didn't want to continue, I completely understand that, because it was no way to live. I mean, and I can say that about my own daughter, which was a really hard thing, and I'm not crying every time I say it now, but it's really hard.
Yeah. But we have a happy ending.
Yeah.
Thank you